In the summer, we treat a lot of plantar fasciitis in our office. People tend to be more active, they're on their feet more, they're walking around barefoot more frequently, and it just puts more stress on the foot. Now, what is plantar fasciitis? Plantar fasciitis is simply an irritation of the tissue on the bottom of the foot, specifically the plantar fascia. Now, when we put more stress on the foot than the foot is able to handle, we can get a weakening or an irritation of that tissue, and we describe that as plantar fasciitis. Now, what does plantar fasciitis feel like? For those of you who have had it, you know how painful it can be. The telltale sign is that first few steps in the morning, it feels like you're walking on glass. Now, it can loosen up a little bit as the day goes on, but as soon as you start to put more stress on the foot, you're on your feet more, you're working out, you get that sharp pain right at the base of the heel. That is the telltale sign of plantar fasciitis. Now, what causes plantar fasciitis? If you're an athlete, you need to look at your training schedule. Are you training more than your body can handle at the moment? Specifically runners, take a look at your weekly mileage and see if you've bumped it up recently. Being overweight also puts more stress on the bottom of the foot and can lead to plantar fasciitis. Some contributing factors that may or may not be the direct cause of PF are going to be footwear. Are you in an old pair of shoes that's putting more stress on the bottom of the foot? Footwear including flip-flops. Flip-flops change the mechanics of walking and can put more stress on the plantar fascia. Additionally, we need to look at the flexibility of the calf muscle. Really tight calves have been shown to be a contributing factor to plantar fasciitis. So now how do we go about treating plantar fasciitis? The exact details of each treatment plan is going to be different for everybody because the cause might be different from one person to the next. But the biggest theme throughout all treatment plans for PF is going to be strengthening of the tissue on the bottom of the foot, and that is customized to the individual. So I'm not going to be going through strengthening protocols because it's going to be different for everybody. What can help somebody might flare somebody up. It might not do anything for the next person. So we need a customized plan in terms of strengthening for each individual. But what we are going to go over is stretching for the calf musculature. This is really important because if the calves are tight, it can put too much stress on the plantar fascia. So here are two great stretches for the calf muscles. So the reason for two stretches as opposed to one is because we have two muscles in the back of the calf that we need to stretch. One of which crosses the knee joint. It's called the gastroc, so we're going to stretch it standing with our knee straight. The next one is the soleus. It does not cross the knee joint. We're going to do that in a kneeling position here in a second. So to stretch the gastroc, we're going to keep the heel on the floor, and we're going to elevate the front of the foot, keep that knee straight, and we're simply going to rock back and forth 10 times. You should feel a pretty good stretch in the top of your calf. This next stretch is for the soleus muscle. We're going to do it in a kneeling position, again with the front of the foot elevated, just to add some tension to the back of the calf. If you get a good stretch without the foot elevated, that's fine. So what we're going to do is simply get into this kneeling position and rock back and forth 10 times. We should be feeling this stretch lower on the calf. So I hope that was helpful. Now, these are general guidelines for plantar fasciitis. This is certainly not meant to replace traditional medical care. So if you or someone you know is experiencing heel pain or what you think might be plantar fasciitis, seek out some professional help. We'll have a link in the description below where you can book an appointment with us and we can talk about your treatment options. Thank you so much for watching.